Dr. Vijay Kumar, our National President, and thank you, MediBiz TV, for giving me a chance to speak. I'm not giving a speech. I'm giving a scientific talk on patient safety. So it's reverse a change in me that I'm not doing any speech. It is a talk on this important topic because if you see today, it is not only important has become to treat a patient, but how safely you can treat a patient, it has become important because of medical legal issues, because of now the people getting aware, and it is a need of hour also. Patient safety has become, what do you mean by a patient safety? A patient has come with a pain abdomen and he goes from the hospital with a fractured leg. How the patient will feel about it? If you see, there are in a developed countries also, 1 in 10 patient is harmed while receiving a patient in a hospital care. Maybe because of some small errors or adverse events. This should not happen. 1 in 10, that's a huge number. Each year, 1.3 million deaths are occurring because of unsafe injections. 1.4 million worldwide suffers from hospital-acquired infection. The patient he has come with one illness, maybe in heart, maybe a myocardial infection, and he goes with some another gastroenteritis or some other infection he is getting. For that, how much millions of rupees, billions of rupees are being lost. It has been estimated $6 billion to $29 billion. And unfortunately, in India, we do not have any data. It may be a very huge figure because number of patients we treat. Just see these headlines. Cancer boys dies after blunder or injections, teenage patient. These are becoming headlines and these are very important nowadays as a medical legal issues for all of us. Teenage patient dies of doctor's mistake. Doctors will make mistakes. Teenager given wrong drugs. So all patient dies of infections, fatal infections after admitting in the hospitals. So these are fatal conditions. These are medical legal issues for which now we have to keep a concern. Design works so that easier to do a right thing and hard to do it wrong. That's very important. And just think of when we say our hospitals are very safe. Just see the line. 1 million, if you are traveling in an aircraft, there is a 1 million chance that a death or accident will occur. But while in a hospital, if you are admitted, there is 1 in 300 chance. So just think of it. We have to improve ourselves. That is the need of hour. If the aircraft people can do it, why not we, where also the life and death is at stake. But unfortunately, till today, when we talk about patient safety, our doctors, our nurses, I am giving you an actual picture. When I talk about this in my hospital also, people either are talking to each other or sleeping or not giving any consideration. But the time has come that you all have to see it very carefully that what does that patient safety means? What does it mean and how can I prevent all these things which are preventable? When we talk about patient safety, when I'm talking of all those things which are preventable. So what is patient safety? Is the absence of preventable harm to a patient during the process of healthcare. The discipline of patient safety is the coordinated efforts to prevent harm. It is not only a doctor but the whole healthcare personnel who are working in the hospital. But you being a leader in healthcare sector, a doctor being a healthcare sector, the prime responsibility remains with the doctor only. What can be the things which you are looking for when you are thinking of patient safety? Surgical safety, hospital infection control, medication error, radiation safety, material safety. Material safety means what is the floor of your ward, what is the color of your room, what is the paint you have used, because these all lead to some concern with the patient safety. Facility safety, and another important thing is your safety is also a concern because you also can get an infection. I have seen number of our doctors and number of our nurses getting HIV or getting hepatitis surface antigen, B antigen or C antigen because of needle stick injuries or because of inappropriately handling during the surgical cases. So patient safety as well as our safety is both important. Surgical safety, let's come out to surgical safety. 3 to 5% of adverse event globally. I again saying these data is not available in the country, so maybe very high because we are not used to in having documentation everything. Causes, poor anesthetic practices, poor communication. That is one of the most important thing. We as doctors have never learned that communication is so important in our cases. Then surgical site infection. That is one of the most important thing which is going to happen in medical legal cases. Insurance company can refuse to pay the bill because they will say the surgical site infection has come because of inadequate infection control practices in the hospital or inadequate practices being done by the doctor. So this is an important thing. Preventable cause of injuries. Again, surgical site infection in USA, even already they have banned. They don't give reimbursement on this issue. The hospital has to pay for that. Then is essential of safe surgery. Correct patient at a correct site. What to do for all these things? We always say, but what should be your checklist? Prevention of harm from anesthetics. Protect from pain, hypovolemic patient, anesthetic safety checklist. Documentation has become very important. We have to have a checklist of everything and it is to be signed by everybody. Who's the doctor, nurse and anesthetist. The surgeon, anesthetist and the sister in charge, they have to sign that checklist. Then prepare for a respiratory function compromise. If there is you have gone and seen the patient that it can be difficult intubation or something, you should have a difficult intubation kit, alternative method. All these things has to be documented. If these are not documented and during the time of surgery something happens, there is a difference between medical accident, medical error and medical accident, medical error. Medical accident can happen, but medical negligence will be taken as an offense. If you have rightly documented everything, it will come under medical accident. But if you have not documented these things, it will become a medical negligence. So you may write that you have seen these things that there is no difficulty in intubation, but you are having that intubation kit also with you. These will minimize risk of surgical site infection. Pre-operative assessment, treatment of remote infections, appropriate hair removal, hand hygiene, appropriate prophylactic antibiotic. I must tell you on prophylactic antibiotic, I have seen my surgical friends. They are giving prophylactic antibiotic, but they are not giving in right doses at a right time. If they are being caught at this point, they will be in problem. Similarly, after a prophylactic antibiotic, they have to write if they are giving another antibiotic after the surgery. Why they have initiated this? Because most important thing in the world now, it has become a rational use of antibiotic. In a all clean surgical patient, if you are given a right dose at a right time, this prophylactic antibiotic, there is no need of giving any antibiotic at all. But if you are giving it, give a note on this that that's why I am giving it. Otherwise, patient can sue you for this, that unnecessary treatment being given to me. Then maintenance of normothermia during surgery. You have maintained, but please have notes of all these things. Preparing essential of safe surgery, prepare for a high blood loss, avoid allergy, avoid retention of instrument and sponge, secure and identify all surgical specimens. You all know all these things. So, effective communicate and exchange critical information, establish routine surveillance of surgical capacity, volume and result, that unnecessarily we say that patient is waiting. He has been, you have a long list of patients and you have asked the patient to be orally nil. He can say that why I have been put orally if you are not giving me this, doing the surgery today. So you have to, nowadays the time has come that you should plan everything up, in a proper way, number of operations rooms, number of surgeries, number of trained surgeons you have, post-operative mortality and mobility. Now, what should be your safety checklist on this? There has to be informed consent, sign in, time out and sign out. These are three things you must remember who are surgeons here or you are running a hospital. What is sign in? Pre-induction of anesthesia. There is a checklist of pre-induction of anesthesia, what you are going to do. Before making surgical incision, they are called a time out. You can just say bring out the time out checklist and see it, all these things are there or not, and sign it. Then is after the surgery, before shifting the patient to an OT, that is called sign out. You should have 3 separate lists. I will give you those lists. What is that? Sign in, informed consent, any allergic reaction, anesthesia safe check, monitoring check, difficult airway, blood loss. All these things you have to write and say that I have checked it. That blood loss, this much of blood loss is expected, that being taken care. Difficult airway or not difficult airway. Monitoring checks, blood pressure, aspirin, you have to write and please sign these things. That yes, all these things have been checked and signed by you. Time out is when you are giving a surgical incision. Before that, introduction of the team, name and role, who will be in the OT, who will be your assistant, who will be the sister in charge. Confirm patient name, procedure, site and site. Number of times you have heard that different site has been operated. If this is taken care of and signed, this thing will not happen. Even if it happens, but you have taken a proper care, the penalty will be less. Confirm the sterility and equipment availability. Another important thing, again I'm saying antibiotic prophylaxis. The timing of antibiotic prophylaxis is very important when you have given. This is the time just before starting the surgery you have to give this. So you have written it, you have signed it, it is think that everything has been properly cared. Any imaging required, and it is not that after starting a surgery you start thinking that I need now an X-ray, which I used to see when I was I was a medical student, that then this portable X-ray was used to be called from somewhere, but the time has changed. It has to be there because everything is being monitored. At what time the patient has entered and what time it has been out. Why there is a delay if there is a delay. All these things have to be documented. There are a number of cases which have happened, you must have seen, even in one Kerala also there is one case is going on. So these things, we must be taking care of all these things. Any critical event expected, surgeon and anesthetist should just think about it and they should write that these things can be because of this critical ill patient, these things can happen. Sign notice, confirm procedure, then again sponge and instrument count, specimen number, label, name of the patient, equipment failure. If at all has happened, it can happen. Maybe after later on some adverse thing has happened with the patient and then there is an inquiry, please write it down. That this thing has happened and we have taken care by this. Key concern post-operative management, we write, this is a checklist. I have told you everything and this is what the checklist is designed by WHO, you will find in any website. It has to be there nowadays, it is very important. Then is identification of common errors. You must identify all those things which has been there. Perceived barriers is lack of acceptance. Like today when I am talking, I am not knowing how many people will be feeling that yes, it has become important. It will take some time. When now the adverse conditions are coming to us, to our professions, maybe we are more inclined towards knowing all these things. Previously not. Even I remember 4 years back, I never had taken care of all these things, but today I am become a spokesperson for all these things because of my knowledge and because of seeing now, after being in Indian Medical Association, seeing number of people, our number of colleagues are being affected by this. Then lack of awareness, communication gap, lack of willingness, effectiveness of reporting and lack of surgical safety data. Measures to overcome these barriers is, one obvious is that we have to create awareness. As I am standing before you, then is training is also important. Another important thing for which we are always lacking because we never believe in documentation. Collecting data. Even if something has happened, we should write it down. How these figures comes in from other countries? Because they are writing it down, and when you are writing and documenting it, there is no harm, there is no medical legal issues. If you are not writing it, then it becomes a medical legal issues. And obviously the last thing, rewards are very important. Punishment may not be harsh, but just calling him and saying that you have done this thing wrong, but rewards are very important. Communication. That is one of the biggest error which has always happened, especially in our country. Doctor to patient, doctor to nurse, always we are very used to giving oral orders. If suppose I am from North India and I am working here in Kerala, and if I say some orders, 100%, 99% surety is she will understand something else. Similarly, I remember now my college days in North India, in Delhi, where most of the nurses used to be from Kerala, and now if we collect data, I can say 50 to 60% error were there. Because what they were speaking and what they were understanding, there was a gap because of a language. We are not used to giving written orders. It has to be written orders, and read back policy. That is one of the most important thing we must understand. Read back policy, what she has written or he has written, you please ask them to revert back to you. That what is there only. Nurse to patient care, support and post-discharge care. Patient must be told. Again, a medical legal issues can come if you do not tell the patient after going home for how long this treatment he has to take, when they have to come back to you, there can be a medical legal issue. So please, our documentation has to be proper. And handover, written handover should be there. Even if from doctor to doctor, nurse to nurse, these handovers has to be written in writing. Just see, benefits for patient. Increased safety, a smiling face can make a lot of difference. Increased safety, continuity of care, decreased repetition of history, greater patient satisfaction, because you have everything in writing, everything and communicating well. And for clinicians, professional protection, that's, I think, today the most important thing. Professional protection. You have seen how much loss, 11 crores compensation a doctor has to give. I do not know how many you are there, but I know myself, if 11 crore rupees I have to give, even my ancestral property or my family property and my brother sister combined together will not be 11 crore of rupees. So we have to be careful about all those things. And now the criminal charges are also being labeled on doctors. So you have seen in 1 year imprisonment or 2 year imprisonment, these all things are happening to a medical profession, though for which we have to fight, but we have to safeguard ourselves also on these issues. Educational, greater job satisfaction, these are things. Common error in communication is unfamiliarity to local language or to English, which is normally there in India, especially where there are so many languages, so many other things. So in giving writing and repetition of things is important. Lack of empathy, when we are saying, we are talking to a patient, there is no empathy to the patient, but we are just saying, how are you? How are you? How are you feeling today? There's a lot of difference between saying also use of jargon. So I remember one of our few teachers were very good in their English language, and he used to have such a good English. We were all being amazed by this, that what a good English he is speaking. But after the lecture, I was not able to understand. Most of us were not able to understand what he is speaking, what he was talking, because they were so difficult words. There is no need of all these things, especially when you are taking a patient care. More important thing is your health staff, your patient should know what is being spoken over there. Another important thing, medico legally also, and for giving proper order also. No overwriting. If you want to change it, cut it and write it and sign it, so that they know that who has cut it. Is important. Anybody can overwrite it. So there is not be overwriting on this. You want to change that word, don't put a cut, write it down again and sign it also, so that it becomes authenticated that you are the person who has done it. Nobody else has done on your behalf. Attention being diverted, glancing here and there, that also is important thing. You must have seen patient always say that when I was giving my history, doctor was talking here and there and something wrong happens, then he will blame doctors that he was not attentive while I was even during surgery or during my care. All things can happen in like that. So strategies, use simple language, responding skills, listening, empathy, non-judgmental attitude, self-disclosure, obtaining feedback is important. Obtaining feedback is how you improve. Avoid information overload. Alternative method of communication. The biggest way of communication is a warm touch to your patient can make a lot of difference. That must remember that. Appropriate facial expression and body language. That is also important. If you are talking to your patient, it's very important how you are talking to your patient. When you're taking your history, how you are taking that history or how you are asking him. And all these things required, and they will ask for it. Monitoring. You have given awareness, but if you are not on monitoring, I have seen in my hospital also, out of what we speak, only 20 to 25% goes. Rest of things, we have to repeatedly. Behavior change comes when we do repeated things. So monitoring is important. If you find 30%, again you have to do the awareness program, and then you will see the graph increasing. So feedback analysis, training audit quarterly, feedback analysis monthly. You can change the month or twice a month, but it has to be done like that. And OVR immediate, any adverse reaction happening, immediate do it. Then comes the hospital infection control. That's another method. Other important errors which happened is infection control committee should be there, policy and protocol should be there, training, surveillance, auditing. Auditing, please remember, nowadays this is again has become important. Auditing means you are evaluating your process in your hospital. You are doing it yourself also, but please call somebody else also to do this auditing. That will carry a lot of meaning during the time of adverse conditions. If somebody goes in a medical legal case, these becomes important for us. So please remember, external auditing is there. Common errors in infection control. Non-uniform compliance by different personnel. Polymicrobial prescription and frequent changes. I think this is the most important things in today's scenario. Our doctors are used to writing so many and the newest possible antibiotic they write. You must know that drug controller and government of India has issued guidelines that carbapenems or other high-end antibiotics, if you are writing, you have to give the cause why you have to give the reason that why you are writing it. So please write it, give a one, otherwise as I said again, these are high cost medicine. One, unnecessarily you can be labeled because you are taking a kickback, or secondly they can say that why you have given it, they are high cost, patient can refuse to pay it because I can be treated by a simple antibiotic. Why? So it has to be a evidence based, or even if it's not evidence based, but you should write carefully that because of this reason that he has already taken so much of antibiotic, I am writing this. And combination of drug, it has been seen. So please don't write combination of drugs. Inadequate doses. One of the auditing which we did, we found 30% of our doctors have written either inadequate doses or inadequate durations of drugs. Please remember, if these fallacies are there, nowadays it is difficult. But also I think for a patient point of view also it is important. Then belief and conviction, therapeutic interchange. You are talking of a therapeutic interchange but writing something else, or a combination of drug because that drug is not available. You are saying that brand is not available. You are writing something else of the same thing but giving a combination of other things. So important. Lack of awareness about policies. What is the antibiotic policy of your hospital? If it is not there, make that policies and accordingly you should write. If there is going away from that policies, you should write the reason. Strategies to minimize. Bring about behavior change, as I said, education and training, regular monitoring, review of policies. Then is tools. What should be used? As I said, auditing of everything is important. Forms and format, you should have your SOPs ready. Audit is very important. Incentive and recognition, that's very important. What you simply can do, observe how many people, on a hand hygiene surveillance. Very simple thing. Hand hygiene surveillance is very important. If you have done that, I think nobody will ask you question in your hospital infection control policy if you have a small hospital. What is the compliance of a hand hygiene policy? And one who does the best way, give incentive to that nurse or a doctor or somebody who is there, or a healthcare worker, whosoever it is. That will be one of a great incentive you can give, and you can protect yourself also. Lack of funds, important thing is people don't care about these policies in a hospital. They say lack of funds, but this is the most important thing, you have to do it. Lack of motivation, leadership, conviction, fixed beliefs and myths of healthcare workers. They have a belief that there's nothing happens, even if hand washing is not important. So I do not use gloves because I get allergy, so healthcare worker will say, I will not use it. But you have to change their mind by creating awareness among people. Monitoring, I think, as I already said, is important. Another important thing is e-news incorporating your hospital antibiogram. Every monthly or 3 monthly you prepare how many patients have come, what is the antibiogram and antimicrobe uses quarterly. This is a very important thing. Prescription audit, another important thing which should be done. Medication error, another important thing. Every year, as I said, I have a data which is all from foreign countries because we are unfortunately do not document and we shy away from these things. Do not shy away, I say, sir. 1.5 million Americans suffers injuries because of this medication errors. What is the order? In your hospital also same, procurement, storage, ordering, dispensing, administration, documentation, monitoring and reporting. Any of these things can go wrong. Most important, medication errors. Prescription errors, 10 minutes. Prescription error, 56%. Administration errors, 36%. Just see, 56% is a prescription errors. That belongs to all of us as medical doctors, medical professionals, 56 errors. Administration and nursing care, 36%. So just take care of this. Just see this, what has been written, and we feel pride. I know, I also used to feel pride when I just started my internship that how bad I can write so that nobody can write, because the chemist used to say it's very difficult, or patient also used to say, doctor's handwriting is very difficult to read. I used to take pride that I have to write right way, so that it becomes only legible to a chemist, but things have changed now. You have to write in capital letters your doses and your drugs. Otherwise, there can be a problem on that, and that medical legally also you are not safe on this issue. 7 R's, right patient, right medication, right route, right dose, right time, right purpose, and right documentation. The most important thing to which we all lack is right documentation. Sound alike. If you are in a hospital, there are so many drugs are lying, and you will see Fortem and Fortwin has been given. Do one kind of auditing in your hospital. You have written Amicon, Amicar has been given. These are, so you have to see in your hospital who are those who are sound alike. They have to be separated out, and they have to be recheck again what nurse is giving it. Sound alike, look alike. Alprax, Domstal, Dextrol, these injections look so alike that somebody can miss it. There can be error on the part of a nurse, she can give anything. So please, when you are writing, we have to make these nurses or ourselves, our junior doctors aware about all these things. They just see this, they look alike, but they are all different things. And somebody can just thinking that this is a drug, they can give it. So have to be careful on these things. Just see adverse effect. If you see this, you find adverse effect, no penalty. But if you are giving without other things, medical errors, and where you have not even tested it, there is a problem. So you see, these is around 60% errors are happening of errors. So where we have a medical legal issue. So please remember that. Strategies to overcome barriers, strict emphasis to follow 7 R's, a lot trained and designated medical nurses, all handovers related to patient and his medication to be done in writing. So writing is very important, and again incentive and recognitions. These are the bands which you should use, the high risk cases or allergy, because sometimes on a case sheet you cannot see it, though these things has to be written. Just 5 minutes more, because tools for implementing strategies, then is prescription. Well, write in a capital letters approved name of the drugs which is there in your drug formulary, doses, that's very important. Training is important. Then is, if you do not do all these things, I'm afraid there were complications, and the doctor is also in a bad mood, and the patient is also bad mood. Doctor's bad mood is okay, but the patient bad mood is a very adverse condition for us. This is the greatest adverse thing which can happen to us. So what is that? What you can do is patient safety principles, the correct identification of a patient and matching of a patient to their care and elements, prevention of patient care handovers, errors, and safety during transition care, assuming medical education accuracy, performance of correct procedures, clinical focus areas, design guidelines, and then software toolkits to monitor it, audit it. That is the most important thing, that how your things are happening. What is a safety cycle? Suppose you have seen a harm, understanding the cause, identifying the solution, evaluating its impact, and then translating evidence into safer care. That is the most important thing. Last thing, that's a very important, clean hands, save life. This is the steps which I have shown you. Wet hands through underwater, not hard, in a warm water, apply a small sport, wash hands for 15 seconds. I have still seen people washing, I'm talking about it, your social hand wash. Rinse well and dry it, and use a turn off the lap with a paper towel. This is one. So patient safety starts with me. We all can work together. Doctor is a leader. Rest of your staff is a team worker. But as being a leader, you have the responsibility of teaching them, educating them, and then auditing them also. Thank you very much.